When I look at a deep fold and I look at the architecture of what's occurring there, and I'm a frustrated architect at heart, I see that there's a deeper component. There's fat, there's deeper structural components to the skin. And then I see that there's actual problems right in the very superficial layer of the skin. And it seems like one filler or treating one part of what I see as a more complex anatomy is just not enough. It often falls short. And so many years ago I came up with what I call the bilayer technique, where I use something that is more substantive, specifically radiesse, which is thicker, more like a paste, and we use that deeper so that it creates a structural improvement where we might have worn out fat through the years to create kind of a foundation. I really do think of this as like building a wall or building a structure of sorts. And so I create a foundation with the radiesse. We let that sit for several weeks and it finds its home. And then we come back and layer a hyaluronic such as Juvederm or Restylane superficially into that line. And now we've treated the deeper components, which are structural, and the superficial component, which is the visual part that you see, which is the fine line in the skin. Not only do we treat it more like what has actually happened there, but we get a more durable result. And what I found when I first started doing this is that patients weren't coming back as often, and I thought that maybe they were unhappy with it. But in reality, it was that this was actually lasting longer, and that was a very good positive that came out of it.